There we are. We are probably, it sounds like 15 minutes apart driving, but we're joined here on the internet. Foxy lady, Dr. Fox, Dr. Terri Fox. Before we get sued, I'm going to cut that off. Thank you, Jimi Hendrix. One of the best to do it. Dr. Terri Fox, thank you for joining us here on the Bono's Health podcast. How are you today?
I'm good. Thank you for having me. I'm excited to be here.
Yeah, it was nice to see your name come across the emails and then dig into some of your stuff. And I think that the topic, one of your specialty here is mold toxicity. You do have a master class. We can throw that out in the beginning. He said if it comes up naturally, there it is. And I do think it's one of those things. Again, Lyme disease, mold, things that for the general audience, when you're chasing these fitness goals, that's what a lot of I think my folks are seeking. It's hard to catch these things. And your website here, the Dr. Fox Medical Detective, is something that a lot of medicine is missing. I would love your take if we wanted, without, again, throwing medicine 2.0 for anyone familiar versus medicine 3.0 being more proactive. And then even when people are dealing with symptoms for a long time, they get kicked down the road. And we're talking about a sick care system, a unfortunate, not fully holistic system. And that's where I think doctors like Dr. Fox here come in. Would love to hear your take on how the medical system is struggling so much to identify these concepts. I know some of it is comes down to the evidence is not there. Maybe there's special interests, lobbies. How deep do we want to go down the paranoid rabbit hole? But I'd love to hear again your take as again being in Boulder, like we were just talking about before we went live. A lot of folks are probably much more ready to come find you, more ready for that we call it alternative, not trying to throw it in under a negative thing, but allopathic medicine is the more traditional type versus we're talking about here functional medicine. So we'd love to hear your take on why is it missing? How does the public get a little more educated? Obviously, outside of podcasts like this, a lot of the podcasts I'd heard you on were probably very specific to people seeking out Lyme disease, mold toxicity things. But how do we get that information out to the general public? And how do we get general practitioners in the American Medical Academy to get a little more on top of this stuff? And maybe you can give us an update on where the medical system is with some of that.
Yeah, sure. And so do you mean in relationship to biotoxin illness, to mold and Lyme, or more functional medicine overall?
Yeah, I think that, again, when people start coming in with symptoms and they're getting diagnosed with fibromyalgia, they're getting diagnosed with rheumatoid arthritis, doctors are usually not even, maybe they're talking about, what are you eating? How are your exercise routines? Maybe they're saying, hey, maybe you should go get yourself tested for, your house tested for mold. Maybe you have black mold growing somewhere, things like that. Some people might be somewhat familiar with these concepts, but I think connecting the dots on the symptoms, the presentation, that's the part where I think folks might benefit from hearing, oh, I have been having this brain fog and this fatigue for a long time. And yeah, we haven't looked in our attic. We haven't, looked into any of these things. We did have a leak a few years ago, things like that, where I think putting these dots together becomes something that, again, traditional medicine they don't necessarily ask these questions. They're going to do testing. They're going to say, what can we find on this person with our current technology that insurance might or might not cover? And we don't approve these tests over here. So this is the system, and I like to navigate between these spaces. I'm a big believer again in functional medicine. Had plenty of practitioners on here who practice that. So yeah, I'd love to hear what that gap is. First of all, I think for the general public, but also for the medical system of allopathic medicine versus functional medicine, if that question makes any sense at all.
Yeah, sure. So I'll start with just functional medicine. So functional medicine is looking for the underlying root cause. So as opposed to treating each symptom with a separate thing. So you have high blood pressure, we do a high blood pressure medication. Your lipids are high, we do statin, et cetera, instead of looking at what is the root cause of cardiovascular disease. And, is the person inflamed, and is the inflammation starting in the gut? And is it from their diet? Is it from dysbiosis? Where is that all starting? And, are they exercising and using their heart in different ways that help to keep it healthy? And so functional medicine is more looking for that underlying root cause and looking at the whole picture. So, what I get is patients who've seen 20 to 40 doctors and gone to all the specialists. They've seen the rheumatologists and the neurologists, and sometimes they've been to the Mayo Clinic. They've had scans done, and they all say there's nothing wrong with you. And, so by the time they come to me, at least they've been ruled out for a lot of the serious stuff. So I don't have to do that part. But that, it's kind of my job to figure out what's actually the cause. And a lot of those trash can diagnoses that you just sort of mentioned, like fibromyalgia, irritable bowel syndrome, chronic fatigue syndrome, those are all like labels that mean nothing. So they're like, okay, you're chronically tired and we don't know how to help you. So we're going to call it this and go ahead on your way. Good luck. Whereas for me, chronic fatigue syndrome is a silly label. If somebody's fatigued, and there's always reasons why, and you can always figure out what the underlying root causes are.
Yeah. So I guess the other part of that question would be, what do you see as the current disconnect between that traditional medical model and, again, the testing that you do? I think, is it a gap in the current evidence base? There's the old adage or concept that gets thrown around that it takes 17 years for something to be proven in evidence, in the research, in the medical journals, and then be put into practice. There's a huge gap between proving things. And again, with a lot of these concepts that we're talking about, again, you can do a case study on 100 different people, or a randomized control trial. And again, and research is very difficult. It takes a long time, takes a lot of money. There's these huge gaps in the difficulty of it. And especially when we're talking about conditions like Lyme disease, mold toxicity, things like that, and how it affects you down to the DNA level. Can you maybe shine some light on, again, why? I think, that's my big kind of outsider sort of perspective, semi-educated around the concepts. But I'd love to hear your insight as the expert on why there's this huge disconnect between, again, this big pharma model, and the what type of things you practice and folks actually find benefits with.
Yeah. So, I mean, I agree with you. I do think Western medicine, allopathic medicine is really, really slow to take on new information, and they want these huge, long, drawn out studies. And the whole evidence-based thing, I sort of think, has slowed us down and taken away some really good treatment tools. So, an easy example is, if you're doing herbs, so using some herbal medicine, and, you learn enough about the biochemical pathway and what it does, on your adrenals or whatever it is, nobody's going to fund a massive, study on an herb because they can't patent it. So nobody's able to, spend millions of dollars or hundreds of thousands on this huge study because they're not going to be able to patent it because it's a plant. And so those studies don't get done. And so they just get sort of thrown out by the Western medical community. And then, with the whole evidence-based thing, it's not that it wasn't a good idea, but how the pendulum just sort of swings sort of dramatically in another direction. So I always felt like, so if a treatment works for 30% of the people, that you're testing it on, but it's not, statistically significant, it's not 51% or whatever, then they just throw it out the door. And I'm like, what about those 30% of people that got 100% better from that intervention? Like, why are we throwing that out the door? Like that, why not try that on some and see if it works? And so it's a little, driven by big pharma. So who's going to pay for the studies? And then, the regular Western community is sort of like, well, I don't see any studies on it. So how do I know that it's safe? And there's a little bit of like, I don't know, common sense and the art of medicine and looking at the whole picture and trying things and, being creative and being curious, that I think gets a little lost in the, go to one specialist. Well, you don't fit into my lens of any of my diagnoses. Can't help you. And you go to another one. And there's a pretty big disconnect, really. I mean, functional medicine is getting a lot bigger. A lot more people are aware of it. A lot more people are doing it. And hopefully it gets, it's part of mainstream medicine one day.
Yeah, I hope so as well. And I think, again, someone like Dr. Peter Attia, he doesn't necessarily talk about functional medicine, but he's at least bringing light, and with a huge popularity that he's gained, the difference between medicine 2.0, which is that you're in a car accident, we can save your life. We can give you these again, high cholesterol, great. We can give you a pill for it. Versus medicine 3.0, talking about, again, a lot of these things, putting the pieces together, lifestyle change, diet, exercise, that, again, to your point, does not sell nearly as well. But for the folks dealing with those issues and changing the culture around it, one big topic I want to shift to, I'd love to get your take on. I know it's a little bit less in your specialty, but I'd love to hear if it is affecting you. Things like Ozempic, that, again, big thing in the fitness space, something that we've been talking about a lot. I'd love to know if that is kind of working its way into your area of specialty and functional medicine, and if you have some thoughts on the GLP-1 inhibitors, and with this obesity epidemic that we've been dealing with for a long time, all the chronic diseases raising up. Where does that kind of fit in again, your practice and your thoughts on it, as where you stand as an expert in the space?
So I use a little bit of, I get it compounded, usually semaglutide, just the peptide itself, or tirzepatide. So it's a little tricky because, we don't know exactly how safe it is. And in the animal studies, there were some risky, potential bad effects. We don't know how that's going to pan out in humans yet. So I sort of look at it as the balance. So if somebody is so overweight that it's affecting, their joints and their heart function and their whole body's just working, harder, you weigh the risks and benefits of that. And so, if they're 40, 50 pounds overweight and they've been trying, their best, and maybe they're chronically ill and they can't do that much exercise without making themselves more sick. I've used it in cases like that. And yeah, I usually just get them compounded. I don't use the Ozempic brand name, but yeah.
Good to know. Good to know. Yeah, I think I've heard all sorts of predictions that, more than half the population will be using some form of those drugs within the next decade. And again, is it from a fitness standpoint? Again, the big thing is making sure you're continuing to find a way to build some muscle, and there are ways to approach that. We've just had a few guests on. He just put together a guide for personal trainers on how to make sure they're addressing that. And I'm sure there's similar things and issues shifting over to Lyme disease and toxicity, those two big ones. Would love to hear a little bit more for people thinking about Lyme disease. If they haven't been affected with it, they might just think of that kind of bullseye rash, getting bit by a tick. People in the Northeast very commonly dealing with things like that during the fall. We're going into that season now. So be aware, guys, do those tick checks. But you tell the story again on a lot of your other shows that you've been on, so I don't necessarily want to. We can certainly rehash the story of your son, and he dealt with the. Was it? Sorry, I actually did forget if it was mold or Lyme that he was dealing with. I think it was mold toxicity.
It was both.
It was both. Yes,
Yeah. They have a relationship to each other.
Yes, and if you want to tell a little bit of that story of how he went from being a rambunctious kid jumping all over the place to kind of being, I think he stuck kind of hard to get out of bed for 6 months was the stat there.
Yeah. So he was a really just healthy, really fearless, crazy young boy. And he started limping and getting stiff and got anxiety out of nowhere. And then it got worse. I was testing him for everything. He turned out to have Lyme. I started trying to treat him for Lyme. Ended up bringing him to Dr. Stephen Harris in California, who gave us a mold test, and his Lyme test was positive, and I was starting to treat him. And then he gave us a mold test, and my son's mold levels, his urinary mycotoxin levels, were through the roof. And so then, we realized, it's in our house, which we had no idea. And then, got a good indoor environmental professional out who found it. There was tons of mold. We remediated, we moved out. And, my son got better once we got out of the house and we were on, treatment. But so mold suppresses the immune system in a way that allows Lyme to become opportunistic and replicate. So you can have like I grew up on the East Coast. I've, had a million tick bites. Everybody I know has had Lyme. So I'm sure I've had exposure. And if you take somebody who's had exposure and then you put them in a moldy house, if they're mold sensitive, which is only 25% of the population, then Lyme can reactivate and become active. And then you get kind of a crazy mix of mold and Lyme symptoms. And so, from my perspective, you always treat the mold first because a lot of times the Lyme goes back into dormancy if you do that. And then, if you do all the other things in the terrain to clear the terrain to make it inhospitable to Lyme, then you hit it directly. But yeah, do you want me to sort of say what the symptoms of those are?
Yeah, that'd be great. Yeah.
Yeah. So mold symptoms are fatigue and then brain fog. So cognitive dysfunction of all kinds, word recall, memory loss, all that kind of stuff. And then headaches and migraines, insomnia, anxiety, very common, depression, very common, rapid weight gain or loss. Some exercise intolerance where they'll exercise and feel more sick after instead of feeling better. Yeah, those are kind of the other big one is unusual neurological presentations of all kinds. So like muscle fasciculations all over the body, numbness, tingling, weakness, burning, ice pick sensations, stuff like that. And that doesn't fit into any neurologic diagnosis.
Mhm.
And then Lyme symptoms are a bit more like joint pain, achiness, flu-like symptoms, like feeling like you have a low-grade fever a lot. And then depending on which co-infection and with Lyme that you might have, then there's a variety of other potential symptoms.
It sounds like a lot of overlap as well with kind of long COVID
Mhm,
kind of made its way. So yeah, I'd be curious. Is that something you're finding again
mhm.
in terms of the kind of commingling of conditions?
Yeah. Yeah. So the way I like to look at it is you've got like a bucket. So, if you've heard of total body burden, let's say you're born with a bucket and you get exposed to toxins and inflammation, biotoxin from mold and Lyme, those kinds of things. And so you get plastics, pesticides, glyphosate, and then maybe you have some mycotoxins and your bucket still isn't overflowing yet. And maybe you have a remote history of Lyme, so you get some biotoxin from the Lyme, and then you get COVID 3 times, and then your bucket overflows and the system crashes. And so we sort of look at long COVID very similarly to the way we would look at Lyme. So, what all is in the bucket? What can we pull out to have the system come back online? And so there's, a variety of different ways of doing that. But even if like if somebody has long COVID and they have mold and you treat the mold, they'll get better. So it's like just the bucket is full.
Yeah, and I think it's the hard part. You kind of you flew all the way to California just to get diagnosed for your son. Oh, we lost
I
you
diagnosed
there
him.
for a
I just
second,
couldn't
Dr.
treat him.
Fox. Having some technical difficulties.
Oh, yeah?
Hello, Dr. Fox.
Oh, can you not hear me? Hi, you can't hear me?
For anyone
Is that
watching,
better?
feel free to chime. There you go. Yeah, that seems like you
Can you
came
see me
back
now?
for us.
All right.
Yes. Yeah, you disappeared there for a second. Um, maybe Big Pharma's onto us. They're trying to shut it down. They're trying. Hopefully not. But I, I did want to ask of again coming back to the whole concept of the diagnostic process. Again, it sounds like, and even something like long COVID is a little bit difficult to truly diagnose. And you were
Yeah.
saying you had to go all the way to California to deal with one diagnosis for your son, and then we were able to get to another diagnosis, and again figure out all these pieces. Again, as we mentioned, Dr. Fox, medicaldetective.com. That's unfortunately what this functional medicine piece has to become, is this detective work that again a lot of general practitioners, again, that medicine 2.0 is kind of chasing one thing after the other, but to actually put all those pieces together, to sit there, take a 3-hour intake, which is what I think a lot of functional medicine specialists generally are doing and charging for. That's where that comes together. So if somebody is kind of, again, I think you list off the list of symptoms, and folks are like, yeah, I kind of have brain fog. If I don't have my coffee, I'm irritable. Like maybe I have lost energy in the last things. I just turned 40. Maybe that's a normal thing. My sex drive's going down, whatever, things that are, again, kind of nebulous. And maybe it's just like everyone's kind of dealing with that, right? I guess that's where we start to question, when is it worth bringing in someone to I forget the actual term you use, an environmental specialist who can look in your house and say, no, you're all clear of mold. And again, it's not a standardized industry, so it's hard to know who to trust there. But when do we put those pieces together of, your symptoms are now really impacting your life? And like you mentioned, you might be the 20th clinician that this person's seen.
Right.
How can we get there sooner, I guess, what things can we look out for outside of like, oh, I do have these 10 things going on, which I think is often going to get missed. But yeah, I'd love to know if, again, we had a mold issue here in the house, literally when we first bought it. We had it tested. They said no mold. Should we pay a couple $100 for someone else to come in and just double check that as an investment in our health? It might make sense, but to what level can we find that happy place? Because again, we're overwhelmed with all this information. You got people yelling at you from all different directions. It could be this, it could be that, it could be this. You should test for this, you should test for that, you should test for this. So yeah, my question, I guess, coming back to it there is, what can the general person do who has not yet been diagnosed with these conditions do to look out for these things? Again, especially if you didn't have a tick bite, you don't know that you have Lyme, maybe necessarily. How do we put all these ambiguous symptoms together, I guess, and be able to stay ahead of that?
I mean, honestly, I think if you go to a good functional medicine doctor, they're going to start at the beginning. They're not going to, jump to mold or Lyme unless, I get patients now that walk into my office and say, I have mold or Lyme, help me.
Mm-hmm.
But other than those, they're foggy, they're headachy, they're, fatigued. You start with the basics. You do a big blood draw, you look at thyroid, you look at hormones, you tweak hormones, you get them sleeping, you look at nutrient levels, you look at their adrenal plant panel, you do all the basics first, unless there's something, that screams obvious in the initial consult. If they're flu-like, joint pain and achy a lot, I might jump to a Lyme test more often. And the one I would recommend for that is IGeneX immunoblot for Borrelia. If they tell me that this all started when they moved into a new house, or that they did have a known flooding event or known water leak that they never really took care of, and they've got the migraines and some weird neurologic stuff that fits, I might recommend a urinary mycotoxin test, a little earlier in the process. But really, a good functional medicine doc should be able to kind of look at the whole thing and decide which testing you would want. If you have like weird neurologic things that don't fit into a neurologic diagnosis, you've had your scans, you've gone to neurologist, and if you've got rapid, unexplainable weight gain or loss with that, I would probably just jump straight to a mold test.
Okay, good stuff to know. Again, things to keep an eye on for folks. Definitely important there. I've also heard you.
I was also going to answer your other question, where I usually test the person before I test the house.
Okay, that makes sense.
So if the person's not positive, I don't make them pay the $1,000 to get the house evaluated. And now it is. It's like $1,000.
Yeah, no fun. I thought it was a couple hundred, and I was already like, and there's nothing really, again, simple visual that can be done in terms of testing.
Like in terms of the house, you mean?
Yeah.
Well, I mean, I would be really, careful and keep your, you want to keep your eye out for musty smells. You want to have a look in your attic and your crawl spaces and basements and make sure there's no evidence of water damage. You want to check the slope going to your house, that it's not going downward. And, that your gutters are clean and you're using a good HVAC filter, a MERV 13 or higher. And yeah, I mean, things to look out for: any water damage, any musty smell, any evidence or history of water damage. If you're not sick, I don't know, it's kind of hard to get people to then bother paying for the money just to optimize, but it does it, mold will increase your risk of all forms of cognitive decline and dementia. So, there's reasons to care, even if you're not one of the 25% of the population that gets really sick from it.
Yeah. And that's, is there any genetic testing that can be done to determine that at this point? If you are in that 25%, not yet.
No,
not there yet.
There's something called the HLA-DR that we used to use it. And I think 15 years later, we've all decided it really isn't predictive at all. So I don't use it anymore.
Yeah. So connecting also, I've heard you talk about glutathione quite a bit, liposomal version of it, meaning it can bind to the fat and be probably better absorbed. You mentioned IV therapy with that. Do you think that the more pill form is useful, useless? Are we wasting our money there for those taking glutathione maybe for longevity purposes, not necessarily for dealing with some of these infections?
Yeah, so I love liposomal glutathione. Glutathione levels, low glutathione levels are associated with increased risk of all those cognitive decline and all forms of dementia. And so you want your glutathione levels to be decent. And though the glutathione will help recirculate other antioxidants in the system and from your diet. And I think the liposomal one works really well. It's much more easily absorbed, gets into the mitochondria better. Um, and what was your other question? I like using liposomal glutathione over NAC. So
Okay.
NAC is a precursor to
Hmm.
glutathione. So you could theoretically do a lot of glutamine, glycine, and NAC and feed your body the food it needs to make its own glutathione.
Hmm.
But I find people do really well, and the IVs are amazing.
Well, I think it becomes the same thing. If can we do it again, the pill form, which becomes $1 a day, versus the IV form, which might be $100 for whatever it is. Maybe you need it once a month. Maybe you need it every quarter. If you're going to boost those levels, yeah. And then I guess it's. I think the research is probably sparse on the long term effects of that in terms of from a optimization standpoint, less so from a
Yeah, I mean,
symptomatic
honestly,
standpoint.
optimization, I would recommend IV phosphatidylcholine followed by glutathione for brain health, probably more than anything else.
And again, this is all just to stay ahead of the game,
Yeah,
as well as deal with some symptoms when they
optimizing.
do occur.
Yeah.
Yeah. And are there blood tests that, again, even a general practitioner could do to give us some of these levels, or is this more something that only a functional medicine doctor is going to
You
be
can
able to
check
test for?
glutathione levels in the blood in LabCorp.
And you find that that's, again, because sometimes, again, like you can do some of these blood tests and it feels like,
Yeah,
uh,
I can't say that I'm 100% sold that they're accurate. I think like if you do a good specialty nutrient test like the Nutraval by Genova or another one, those glutathione levels I trust.
yeah. Yeah, that's the hard part, I think, for and I'd say you can go on different podcasts, listen to folks talk about these different things, and then the ones with the biggest voices, like Dave Asprey, let's say, who's had some questionable science at best. Things that get called into question. Some of his claims become. I think it makes everyone look bad in a way, right? Who falls under that umbrella. It makes everything much more cloudy when it comes to should I take that supplement. He advocated for activated charcoal for a long time. I don't know how you feel about that as again a pill for somebody, even if they're drinking a few drinks. Should they take activated charcoal? The bulletproof brand, probably not the most important version of it, but should they be doing that to balance out the toxicity of the alcohol? Is that something you know?
I don't know about the alcohol part, but it's a binder, so it'll bind
Mhm,
toxins in the GI tract and pull them out. And so it's just important if you're using something like activated charcoal that you do it 2 hours away from other meds and supplements on both sides because it'll bind them and pull them out.
mhm,
And then it can be constipating. And then if you get backed up, whatever you bound doesn't, it just unbinds and doesn't really work.
right.
And so they have to know, to increase their magnesium if they're using activated charcoal. But I don't think it's a bad idea for, twice a week to use binders just because our world is toxic or, our
Mhm.
buckets are full and we've got 700,000 different chemicals that are toxic we get exposed to every day. So, a little daily detox can kind of go a long way.
And you mentioned the infrared sauna again, often as a really good way to detoxify. And I just
Mhm.
would love to hear your thoughts on the difference between the infrared and the traditional sauna of just, again, sweating, or if you're doing cardio in general and you're getting a good hour of sweat in a CrossFit class or F45 or what have you. So yeah, would love to hear your take on the differences. Again, I know infrared
Yeah,
gets
sure.
brought up a lot.
So sweating is great detox. You have the urine, the stool, and the sweat as your three main ways to get things out that we want not in our bodies to be healthy and vibrant. So any sweating is great. My understanding is that the infrared light goes like 2 centimeters into the skin and pulls out more toxins, more mycotoxins, biotoxins from Lyme. I wouldn't say that that's my specialty, though, that, I could be, that's what I was taught. I don't know that I've ever looked into it super deeply, but we know it pulls out
That's totally
mycotoxins
fine.
really well.
Yeah, again, I was saying before we went online, I'm about to invest a couple $1,000s to put the traditional sauna in my house. My understanding of the research is they're just, and I'm not doing it for detoxification specifically. I think, the traditional sauna, I think, has been shown to have better cardiovascular benefits long term, improves with heart disease, those kind of things, decreases overall causes of mortality, that fun stuff. So whether it's detoxifying, again, that becomes the hard part, right? Like, could we be testing people's sweat and seeing what's actually going out in that in an
We do.
infrared
We have
versus a
with
traditional?
mycotoxins, like we have done it with mycotoxins. So we use infrared sauna a lot as a provoking agent before you do the urinary mycotoxin test. So we'll have somebody do an infrared sauna, and if they can't do that, then they can do a hot bath or some other form of sweating, because it'll pull it out.
And they're assessing the sweat to determine what's in there.
Yeah, I mean, I can't like, recite the study, but yeah, they found mycotoxins in this on the skin when you after an infrared sauna, which is also why it's important you rinse off right away because it's just out on the skin. It'll just get absorbed right back in.
Yeah, that all
That's more
makes
for
sense.
detoxification. Any sweating, any sauna is awesome.
Yeah, I'm with you. Yeah, and sitting in a 30-minute sauna is usually better than running for an hour to me, but every to each their own. Yeah, I love it. Other things, just want to be respectful of your time, the listeners' time, of big takeaways again. Functional medicine, we've covered Lyme disease, we've covered mold toxicity. Again, tricky stuff. It's all complicated. Anything we could be doing to get information out there. Um, you have some resources as well on your websites. We have the Boulder Holistic is the other one here, and drfoxmedicaldetective.com is the other one we put up earlier. Why the two, by the way, just the business versus?
Oh, sure. So Boulder Holistic is my clinic that I founded in Boulder. That's where I am right now. And then Dr. Fox Medical Detective is the website of the class. I've created a mold treatment masterclass for patients. That's a kind of a step-by-step guided, safe detox of mold.
So, and somebody's, instead of seeing a practitioner, they can kind of do that themselves.
Yeah.
Or they've seen a practitioner that you've gone through the testing, maybe someone's confirmed you have mold toxicity. Check out this link to go through the class and treat it yourself.
Yes.
How long does that process take? Is it variable?
It varies. It's about, I think about 12, no, sorry, over 20 modules. It'll probably take, I mean, it varies so much how much
Mm,
people can detox quickly or they
right.
can't. But 3 to 9 months maybe to do the whole thing. But people get better each week in a
Mhm.
mold detox if it's done well and it's done right.
Great.
So it's a good class for people who know they have mold toxicity, but they don't have a doctor near them that knows how to treat it. Or, they have Lyme and their Lyme doc doesn't know how to treat the mold and they know they have to get rid of the mold first. Or if you've tried to treat your mold and failed, then it's a pretty good guided step-by-step way to do it without failing.
For sure. And I think I heard, confirming, since you are a medical doctor, folks can only work with you if they are in the state of Colorado, correct? From the
Mhm.
medical side.
Yeah.
But they could do the master class if they wanted to. In terms of if they're in a different state and they're looking for a practitioner, are there any maybe things you can help folks be identify yellow flags if you hear certain terms, anything like that? Maybe you can share with the listeners of things to look out for, because it is a kind of wild west of of medicine out there in terms of that. Any would love to
Do you
hear any.
mean do you mean in finding a
Finding
provider?
a good practitioner.
Yeah, yeah.
um,
So, I mean, you can look at the directory at IFM, the Institute of Functional Medicine. If you're more looking for somebody who does biotoxin or mold, you go to ICI, which is the International Society of Environmentally Acquired Illness. Do you want me to put that in the chat?
that's okay. Well, I think we can have that in the show notes later as well, but
Yeah, okay. So that's got a great physician directory. And then so does ILADS, which is the Lyme Association, has a really good physician directory as well.
awesome. Awesome. Yeah. So great things to look out for, and hopefully a bunch of resources for folks. to check out. Love it, love it. And then you're putting out information on social media as
A little
well.
bit social media. We do a lot of blogs. The Boulder Holistic website has tons of information on it and resources.
Great, and folks can go check that out. Again, that's at boulderholistic.com. I'm sure there's a blog tab you can go to right there.
Yep.
Yeah. Anywhere else, folks can reach out to you, or if you want to leave folks with anything else before we sign off.
Yeah, sure. So, I mean, I just like to always say that if you do have biotoxin or mold illness, like that, you can get better. There always is a way to get better. And I've had so many patients, by the time they come to me, they're hopeless. And mold, especially, is a very treatable diagnosis. And so, if you think that's what you're dealing with, have hope and find somebody that can help you treat it, because it's very treatable.
That's a great message, and because yeah, people can certainly get really frustrated out there with the medical system, I think. And again, unfortunately, as we started talking about at the beginning of the show, the traditional medical model probably not doing a lot of testing for molding or mold in general. So something to think about there. And again, I always try to find ways to help folks kind of skip some of these steps, because again, the traditional medical model is probably just going to keep you going from one, taking a different medication, again, treating certain symptoms. And sometimes that can be a good thing. More often than not, though, I think they're missing the boat. And people like Terri Fox here are going to help get you to the finish line a lot faster. And yeah, so thank you, Dr. Terri Fox, for joining us today. Folks, go check her out if you are in Colorado. It sounds like, and again, we work with functional medicine all the time. I try to refer folks that way. But definitely, if you have any concerns about mold, toxicity, Lyme disease, we need a specialist like Dr. Terri Fox. If you're not in Colorado, find someone in your state. Again, she just gave us a bunch of great resources.
So
Hopefully
my
this,
partner in my office is a nurse practitioner, and she does mold and Lyme, and she can work all over the country too.
there you go. So reach out through all those links for anywhere in the country. That makes it a lot easier. And again, even if you're anywhere in the world, I'm sure we can find ways and resources to get you guys feeling better, because these are things that are, again, our modern world is full of toxins and we got to find ways to mitigate that day by day. So thank you again, Dr. Terri Fox. We will sign off.